Skin, our protective shield. Our skin is amazing. It's not just a simple covering, it's a complex, multi-layered organ that plays a crucial role in our overall health and well-being. It's the largest organ in our body, covering an average of 20 square feet. It acts as a barrier, protecting our internal organs from external threats. It protects us from the world, shielding us from harmful environmental elements like bacteria, viruses, and pollutants. When we apply sunscreen, we are adding an extra layer of protection against the sun's harmful UV rays. It keeps germs out and moisture in. Our skin cells are tightly packed together, creating a formidable barrier that prevents pathogens from entering our body. At the same time, it helps retain moisture, keeping our skin hydrated and healthy. But our skin is vulnerable too. Despite its strength, it can be easily damaged by various factors such as harsh weather, chemicals, and excessive sun exposure. The sun's rays can be harmful. Ultraviolet UV radiation from the sun can penetrate the skin, causing damage at the cellular level. This can lead to premature aging, sunburn, and other skin issues. Too much sun can damage our skin. Prolonged exposure to UV rays can result in painful sunburns, which are not only uncomfortable, but also a sign of skin damage. This damage can lead to skin cancer. Repeated exposure to UV radiation increases the risk of developing skin cancer, the most common type of cancer. Anyone can be affected by skin cancer. My husband Paul has been golfing since he was 14 years old. Sometimes he used sunblock and sometimes he didn't. He is now 70 years young and he just got basal cell carcinoma on his nose and his temple. He had to go through an operation. It can happen to anybody. Individuals with fair skin, a family history of skin cancer, frequent sun exposure, a history of sunburns, immune system problems, and a large number of moles are at a greater risk of developing skin cancer. Taking care of our skin is essential. Regular moisturizing helps maintain the skin's barrier function, keeping it soft, supple, and resilient. Skin exposure to UV radiation is cumulative, meaning that each sunburn or tan adds to the total lifetime exposure of an individual's skin. This increases the risk of developing skin cancer. However, it's worth noting that not all UV exposure comes from direct sunlight, as other sources, like tanning beds and some workplace settings, can be contributing factors also. The American Cancer Society emphasizes that excessive sun exposure, especially in childhood, increases an individual's risk of developing skin cancer later in life. Skin cancer, a common enemy. Skin cancer is a common type of cancer. It happens when skin cells grow out of control. There are different types of skin cancer. Some types are less serious, others can be more aggressive. But all skin cancers need attention. Early detection is key. Basal cell carcinoma is the most common type of skin cancer. It usually grows slowly. It often appears on sun-exposed areas. Think face, ears, neck, and arms. It can look like a pearly bump or a red patch. It rarely spreads to other parts of the body. It is a flat spot with a scaly surface, a sore that doesn't heal or returns, and/or a scar-like lesion. It is typically diagnosed through a biopsy, where a small sample of tissue is taken and examined under a microscope. However, if left untreated, it can cause disfiguration or destruction of surrounding tissue and bone. Squamous cell carcinoma is another type. It's more likely to spread than basal cell carcinoma. Squamous cell carcinoma, SCC, is a type of cancer that arises from the squamous cells, which are the thin, flat cells that make up the outermost layer of the skin and the lining of some organs. SCC can develop anywhere in the body, but it is most commonly found on the skin, particularly in areas that are exposed to the sun, such as the face, neck, hands, and arms. SCC may also develop in the lining of the lungs, esophagus, or other organs. Melanoma is less common, but it's the most serious type. Melanoma is a type of skin cancer that develops in the cells that produce melanin, pigment that gives color to our skin, hair, and eyes. Melanoma mainly occurs in areas of the skin exposed to the sun, although it can also develop in places that don't get sun exposure. The main causes of melanoma are unprotected exposure to ultraviolet, UV, radiation from the sun, tanning beds, or lamps. Melanoma can appear as dark, black, brown, or pink growths, unusual moles, or a dark lesion on the skin. The warning signs for melanoma include a change in the appearance or shape of a mole, any itching or bleeding, or a mole that is painful or tender when touched. It can spread quickly to other organs. Knowing the different types is important. This is why you need to shield yourself from the sun. Prevention is key. The sun, while a vital source of energy and life, can also pose significant risks to our health if we are not careful. It's important to understand how to protect ourselves effectively. And remember, stay tuned until the end of the video for more interesting facts and information to help you stay safe. The good news is that skin cancer is often preventable. By taking proactive measures, we can enjoy the sun safely. Skin cancer is one of the most common types of cancer, but with the right precautions, we can reduce our risk significantly. Protecting your skin from the sun is crucial. The sun's ultraviolet, or UV, rays are the main culprit. These rays can penetrate the skin and cause damage at the cellular level. There are two types of UV rays to be aware of: UVA and UVB. UVA rays can prematurely age your skin, causing wrinkles and age spots, while UVB rays are the primary cause of sunburn. They damage skin cells and increase your risk. But with simple steps, you can significantly reduce your risk. Sunglasses with UV protection can also help protect your eyes from harmful rays. So, embrace the sun, but do so wisely. With the right precautions, you can have fun in the sun without compromising your health. Sunscreen, your daily armor. This means it protects against both UVA and UVB rays. Choose an SPF of 30 or higher. Apply it generously to all exposed skin. Reapply every 2 hours, especially after swimming or sweating. Clothing and shade, your fashionable defense. Cover up. Wear protective clothing when you're out in the sun. Think long sleeves, pants, and wide-brimmed hats. Seek shade whenever possible, especially during peak sun hours. Remember, even on cloudy days, ultraviolet rays can still reach you. Early detection. Spotting the signs. Early detection is crucial for successful treatment. Check your skin regularly. Look for any new or changing moles or spots. Pay attention to the ABCs of melanoma: asymmetry, border irregularity, color changes, diameter larger than a pencil eraser, evolving size, shape, or color. Treatment options. A range of solutions. Treatment for skin cancer depends on the type, size, and location. Surgery is a common option. It involves removing the cancerous tissue. Other treatments include topical medications, radiation therapy, and cryotherapy, which is freezing the cancer cells. Your doctor will recommend the best approach for you. Seeking professional help, your skin's best friend. Your skin is the largest organ of your body, and it deserves the utmost care and attention. It's not just about looking good, it's about staying healthy. If you notice any suspicious spots on your skin, don't wait. These spots could be an early sign of skin cancer or other serious skin conditions. It's crucial to be vigilant and proactive when it comes to your skin health. See a dermatologist right away. Dermatologists are specially trained to identify and treat a wide range of skin issues. They can provide you with the best advice and treatment options tailored to your specific needs. They are experts in skin health. Dermatologists undergo extensive training to understand the complexities of the skin. They can help you understand what is normal and what needs medical attention. They can diagnose and treat skin cancer. Early detection is key in the fight against skin cancer. Dermatologists use advanced tools and techniques to catch skin cancer in its earliest stages, when it is most treatable. Take care of your skin, and it will take care of you. Hydration, proper nutrition, and avoiding harmful habits like smoking also play a crucial role in maintaining skin health. Your skin is your body's first line of defense, so treat it with the care and respect it deserves. Thank you for watching. Please share this video as much as possible to help prevent skin cancers. Please make a comment below if you know anyone who had a skin cancer and what types of treatments they have undertaken. Please like and subscribe.